So then we're done, right?
We're going to start over.
So I will call this meeting to order again. Roll call, please.
Kay Wilson,
Here.
Tweed Schuman, Marshall Sabitsky, Chuck Van Etten,
Here.
Jeff Haney,
Here.
Bill Trepanier, Don Pettit, Carol Pearson, Dr. Sabrina Dunlap, and Mike Markren is going to stand in as county administrator. So now you have a quorum.
Thank you. Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I have certification of the open meetings law, please.
This meeting was noticed to the media and the public as required by section 19.84 of the Wisconsin statutes.
Great. We have an agenda that's been set. Public comments. Linda Zilmer.
Linda Zilmer, Edgewater property owner, and I wanted to speak to a lot of the demographic and housing analysis that the county's been getting over time and how that applies to housing. Back in January of 2024, Sawyer County had a housing study done by Extension, and some of that report was also given to the Wisconsin Towns Association unit meeting for all the towns. And recently, the county board saw the report from Forward Analytics. If you look at Monday's Economic Development and Extension Committee meeting, the broadband plan includes a lot of demographic information, and I see some here tonight. It has always been that our county has been aging ahead of the state norm. For 20 years, I've been following this, actually longer, more like 30 years, because having held a management position in a business in Rice Lake, we were always looking at demographics. The difference over all the years until recently is that it was acknowledged that you will never have a birth rate or net in-migration that will take care of the needs for our growth, and that it was recognized that it was going to have to be filled by immigration, although you don't hear that now. Another difference between now and 40 years ago when I first looked to move here is housing was affordable in Sawyer County. That was the one thing that was affordable. If you were going to move here from a city, groceries were higher, gasoline was higher, everything but housing was more expensive than if you lived in a city. And now housing is, as you know, very expensive and out of the reach of most people who are residents here. I really do think that this committee holds the key as to providing some guidance on housing. Number one, if you look at the number of tourist rooming houses, I just ran a report off of DACCAP's website, the number of lodging facilities that we have in here. If you look at the broadband plan that was presented to the committee on Monday, I think we actually have more what they consider vacant houses than occupied houses. And with our aging demographics, obviously some of us won't be here longer, and as that population drops off, then that housing is going to be made available to younger people. So I really do think that this committee is very important for a lot of the things that this county needs to look forward to. And instead of chasing new housing and things like that, housing where people can age in place, housing that can be afforded, that you can afford to maintain, which good luck finding a contractor now. So many things to meet the current needs and anticipate the future ones. I hope that some of these county decisions don't get made in other committees without getting input from this committee. Thank you.
Thank you, Linda. And Tamara Jorgensen Shamansky.
There seems to be a little debate whether I'm in the right place for this tonight, but we're going to give it a try.
Can you please identify yourself and give us your address?
Pardon?
Can you identify yourself and give us your
Excuse me.
address? Thank you.
I'm Tamariah Jorgensen Shemansky. I live out on Mosquito Brook Road.
Thank you.
Anyhow, over the years, I've had a lot of run-ins with different deals. And I just think as a taxpayer and a lot of taxpayers out here, we are entitled to more credibility, competence, and accountability for actions that aren't up to par. For the second time, just 2 weeks ago, my life was in jeopardy because people didn't do their jobs. Sir, we've got a DA. It doesn't even follow the mandates in the Wisconsin code and stay in court until a defendant is sentenced. I was refused the senior bus because the person in charge of it didn't even know the area the grant covered. Not only that, she's been out to the food shelf complaining I get too much food. They have people that keep track of how much you're getting from Word Go. I don't see why she should even be out there trying to say I'm getting too much food. When I volunteered at a food shelf, she made a crack. I sure had a lot of food. Well, you bought shares. If you bought 1 share, you got so much. If you bought 2 shares, you get twice as much. That's not up to me just to go and I'm taking this, et cetera, et cetera. It's mandated. I've been slandered by the sheriff's office. I had somebody that couldn't do her job and get a grant for water, the papers to me to fill out. I come home from rehab. I've got trouble with my legs. I also have Lyme's-induced gout. And they were supposed to be out there when I came home from rehab to see I got in the house and had what I needed. Sheriff's office and the one from Human Services, nobody showed. I laid out there on cold, freezing ground for 6 days until I managed to crawl to the end of my driveway, which is long, and flag somebody down and use the phone. And she comes out, rather than help me get the medication I needed for pain, she tries to commit me. Oh, marvelous. Absolutely marvelous. Do you know that we've got flying fleas up here? Fleas don't fly, but somehow she found some. She said she stood on my concrete or cement steps and knocked on the door. I've got wood steps with cracks for sand and dirt to go through. I mean, we're giving a person that doesn't have any more credibility in this the power to do things like try to commit a person. And all she was doing was covering her behind. They were supposed to be out there. If I hadn't been strong enough to get to the end of my driveway, I would have died. I put my bottle of oxycodone in my pocket. If I couldn't have made it down, I would have taken it rather than frozen to death. I mean, this is just ridiculous. There is no accountability for the things they're doing, and the things they're doing, they just aren't doing what they're supposed to do. I mean, they've got jobs. I can't split and carry firewood anymore. I went to apply for fuel assistance. We got through the name, the address, and all this just fine. The first question, I can't remember what it was, but it was an innocent enough question. I answered it, and her reply was suspicious. Well, I'm mulling that over in my head. She asked something else. I answered it, and the reply was the same, suspicious. I asked why, and she stopped me before I got any further, asking why it was suspicious. She said, I've got to ask you these questions or you won't get fuel assistance and your water pipes will freeze. What water pipes are going to freeze? Pregnant pause. You don't have water pipes? I don't have water pipes that are going to freeze. And a lot of these agencies that you work with, they demean us poor people from Word Go. And not only that, their outlook is so narrow. You're supposed to be living the way they are. The ACLU told me I had the right to live in my tent if I wanted to. But when they tried to commit me, I had to spend 2 minutes trying to convince them that I wasn't homeless.
Well,
I mean, this is
thank you
just
very much
ridiculous.
for your information.
Pardon?
Thank you very much for your information.
Thank you.
Moving on, consider approval of the minutes from the previous meeting. Do I have a motion to approve?
And I'll second that motion.
Motion's been made and seconded. Any discussion on those minutes? All in favor? Opposed? So carried. Outside committee reports. Do we have anything from LCO? Do we have anything from the Senior Resource Center? Right.
Last month we met, Jeff and I did with those guys, and there was an issue where they wanted to serve farm fresh eggs because it's a cheaper cost right now than what's served at the store. And I think we got our answer through who was it now? But it sounds like we still can't serve farm fresh eggs right now. But that's kind of what the Senior Resource Center was wanting to do, along with the people who they serve food to, is they're requesting farm fresh eggs. So I think that was resolved since then. Otherwise, nothing else besides they got a new roof.
The roof is done?
It's done, yeah. I know they wouldn't start this week, so.
Good, great. All right, administration, since Julia isn't here, are you going to be taking over for her? And
Yes.
please identify yourself.
Yes, I'm Carrie. I'm the Deputy Director for HHS. Okay, so a couple things. So 18 of our HHS staff have been using a timekeeping system that was different from the one that is used countywide. Recently, we fully trained and transitioned the remaining 18 staff to be in the county timekeeping system of TCP or Time Clock Plus to align with the remainder of the county. We did recently attend a Director State Conference hosted by the Wisconsin County Human Service Association recently, and we'll be bringing back some great information at the next meeting. And finally, last summer and fall, there was some discussion about our intent to search for a newer, more robust and functional electronic medical record system agency-wide. We did actually apply for a grant to make that possible this year and received approval for that recently. That will mainly cover our implementation fees and a partial year of subscription fees. And the plan is to begin to implement this new system sometime within the next 3 months once the contract is signed. And we'll definitely keep you posted with further updates on the progress. Thank you.
Thank you. Any questions for Carrie? All right, let's see. There was an all-staff training request under your section.
Yes, we are asking to close at 11 a.m. on June 4th for an all-staff training day.
For the whole day?
We would close at 11 a.m. So it'd be open from 8 to 11 and then close.
And is there a specific topic for this training day?
It's more of an all-staff meeting, so we have multiple topics.
Okay,
We can supply an agenda if needed.
you have to motion.
I'll make a motion to have them go into all staff training.
A motion's been made and seconded to approve the training day for June. All in favor? Opposed? So carried.
Can I get clarification on that? It's just, you don't have the date yet. It's a day in June,
It's June 4th?
June 4th?
Yes.
Half a day, you said?
11 to.
Yes, we would close the agency at 11
Okay.
a.m.
Thank you.
The next section is Aging and Disability Resource Center for Adult Protective Services. Do
So
you
we
have a
just,
report?
I don't have the report. It looks like it wasn't submitted, but I do have one update to share. We did hire an adult protective services worker who is going to be starting tomorrow.
Excellent. And do you have population projections and disability estimates?
I don't believe that was submitted. I do.
It is, it's right here.
Oh.
It's on the screen.
I don't have Carol on with us tonight, so I can take some questions back if there are any questions on this.
This would be good to add to one of the other committees. It's a great report.
This must be statewide, correct?
Yes.
This is good timing.
I think,
did look through this.
I hadn't seen this before, so I think we need to have time to look at that.
Would you like to add it as a future agenda item to revisit next time?
I think so, because we didn't have that report. Oh, here it is. Does anyone, do the rest of you want to address this at another time after taking a look at it a little farther, or are you satisfied with this information? It's to kind of what Linda was talking about.
I was gonna say, in the straightforward group too, it kind of goes along with what the straightforward group that came and spoke with us in April was mentioning as well, is what Linda said, so I'm okay with it. I'm
Okay.
reading it just fine, so I
Okay.
don't think we need to move it on to a future month.
Okay. Jeff, are you good with the information? All right, thank you. All right, behavioral health. Do you have a behavioral health report?
Yep, I believe that was included in the packet. No major updates with that.
Does anyone have any questions about the report? Is Alicia online?
I'm online. If anybody has any questions, I'm here. Oh, my picture's not, but I'm here.
Can you tell me a little bit about the Canes Kids Club, if that is being well received by the children?
It is. Allison Carlson is attending that, and this is the second week she went. So she leaves around 3:15 and she gets done around 5:15. We have not had any referrals yet, but it's only the second week that she gone. It took a lot longer to get everything set up than what we had anticipated. But at least we have everything in place now. So we're going to continue this through our CST programming, and further down, you will see where we're going to be working with Sarah, the supervisor for YJ and CPS. Part of that grant and our CST grant is working together to identify kids that are truant and try to get them referred over to CST programming. So more of a wraparound services. So it's working out really well, better than what I thought. We're going to have 2 different sources of referrals. So it may have taken a little bit longer to get started than what we wanted, but I think things are now in place and we can move forward with it. So I'm pleased with what's happening.
With the school year wrapping up, is there going to be anything this summer?
Not that I'm aware of. No, there is not. It's for the school year unless that changes. But as far as I know, it's only during the school year.
And then next year, will you start right away in the fall?
Yes. Yep. That's the intent, Kay. Yep.
Thank you. Any other questions? Thank you very much.
You bet.
Community support and mobile crisis report.
We do have Cole on.
Yeah, and Caitlin's here
Caitlin.
too.
Oh,
Nothing major to update. Just reviewing what I wrote down here. Client census for CSP we've had some discharges, but then we've had new people to kind of keep the numbers the exact same pretty much. So nothing too crazy there. Mobile crisis was pretty similar too, with just 8 calls and a little over half, 5 of those calls resulted in assessments, and only one of those folks was placed on an emergency detention. So yeah, nothing too crazy in the month of March.
So where do they go for emergency detention?
Well, if that is what the outcome will be, it's quite a process. So whoever is on call and does the assessment, we have a list of all the behavioral health units pretty much in the whole state of Wisconsin. And we literally call down that list, starting with the closest options until we're able to secure a placement. And so once we call all of the hospitals possible and either get told that they are full or rejected for placement there for whatever reason, that's when we call in our last resort of Winnebago if absolutely necessary.
Thank you. For the mental health monthly expenses, is there anything that jumps out at anyone? Kind of looks the same. Any questions? All right. Mental health cost by client. That's the same? Oh, boy. Client B is expensive. All right, moving on. Children, Youth, and Family Services.
Sarah Anchelskas, Children, Youth, and Family Supervisor. I have submitted our reports for both Youth Justice and CPS. Outside of that, we are hiring, well, we've already hired our truancy worker, but they're going to be starting as of June 1st. Her name is Melinda Oyos. She is with Hayward Middle School. She is the para and special ed there, and I've worked with her through working with some of our more difficult youth, and she does a fantastic job of connecting with them and building relationships with them, which is often very challenging to do with some of the kids we work with. So she was offered the position, I want to say either 2 or 3 months ago, but we were so confident in her abilities that we were willing to wait until June 1st so that we could have her take the position. In the meantime, we have been utilizing Serona Recovery, which, if you recall, is the program that we contracted with for our new diversion program work that we're going to be doing. They've been filling in, helping get some of the kids that have been referred for truancy for this year up and going and back into school yet this year. The plan is to really build relationships over the summer and make a solid plan throughout the summer, but especially right before the school year starts so that we feel like the kids can be successful, and we're hoping they feel like they can be more successful with the additional support. The other thing is that we are partnering with Ben Tran from LCO. LCO is also partnering with him, and they originally reached out to him and they contracted with him for the opioid crisis. And in him coming and seeing what our communities look like, he started to see some of the other concerns that we want to address more so. We have also talked with him, worked with him on really the collaboration that we want with LCO and Sawyer County. We really want a new approach and view that like there's no LCO and Sawyer County, like these are our kids, these are our families, rather than it feeling so separate. So we will be working very collaboratively with him and some other stakeholders in the community moving through the summer, and he will be running a campaign to basically make education seem cool and very important throughout Sawyer County, and going to be, I think, presenting and doing almost like some pep rallies within the schools and with staff, school staff, to help them feel re-energized and motivated and just be more supportive in that way, I guess. Any questions?
So that will be at LCO and Hayward?
It will be at LCO, Hayward, and Winter.
Excellent.
Anything else?
Any questions? Thank you. Oh. Youth justice.
Sarah just completed her report for youth justice as well.
I beg your pardon?
Sarah just completed her report for youth justice as well.
Oh. All right. No referrals.
There will be as of April.
I
I know.
we were on a roll, January, February, and March. All right. Economic support. Who's giving that report?
Shauna White, I'm here.
Thank you.
So I've got our March data there. Not much has changed. We're staying really consistent in our numbers and also in our timeliness. We did recently meet with DHS last week. We had our food stamp management evaluation review, and that went really well. I want to mention just the feedback that we received from our partners and members who receive these benefits. Customer service was noted time and time again. And I guess we're a little concerned as management that maybe this review would not be so sunny because of some of the difficulties that we had with the COVID unwinding. And I know I've talked about the MAP program specifically when they rolled out those premium payments, and we're still having some difficulty with them, but they are starting to, those payments and updates to members' cases are getting better. But we actually improved. The feedback that we got was better than the state average, and I think that speaks highly of the workers that do the case management of these programs, and that even if we're not always giving them the news that they want to hear, say food stamp benefits are reduced, that our workers do it with empathy and try to work with the members to know what other resources are available to them. So I will be sharing that slide deck with all of you next month.
So have the food share benefits been reduced?
They have, in the fact that during the COVID period, households received the maximum allotment. So when COVID unwinded, it went back to looking at eligibility and basing benefits off of the income in the household. So some households did receive fewer benefits, some stayed the same. But over the last couple years, we've had COVID unwinding where, people did not receive the maximum allotment. And now we are back in most of our counties where you do have to, if you're an able-bodied adult, you do have to be working or looking for work. Doing work searches, working with our food stamp employment training program. And if you don't meet those guidelines, and you're not caring for young children, then you may only receive benefits for 3 months before they would end. It's called time-limited benefits. So that's a change. There was a pause on that, of course, also with the unwinding. So
Has there been any cuts to the Badger Care program?
there hasn't yet. I know that that's an area that hits the national news, but then specifically, Badger Care Medicaid here in our state. There's a lot of proposed cuts. We don't know yet if those will happen or not. If they do, I'm going on 27 years with the county here, so not all of them in economic support, but I can say that over the years, the Medicaid program, it didn't used to serve as many adults as it does now. It used to primarily be a program that served children. So I don't know if those changes will kind of make it roll back to the way that it was, say 15 years ago.
So we're still waiting to hear from the
Correct.
government.
Yeah.
Okay,
Yeah.
thank you. Any questions? All right,
Thank you.
thank you. Let's see. Child Care Certification Report.
Did you want to comment on that as well, Shauna? Or
Well, Northwest Family Connection Resource Center, they presented this data to us. We are doing a review with them next week, Tuesday. So that'll be with DCF. Basically, right now, the only thing that I could say as far as childcare is there's still a need to get providers in our area. It's certainly a program that we would like to see expanded. There's been a lot of effort in trying to make getting certified, becoming a provider. There's been a lot of free training and resources provided. But this is another one of those programs that we're just kind of holding our breath on a little bit to see what's going to happen. We had conversations about this this morning and how the one of the regional offices closed in Chicago and moved to Kansas City. That is the regional office now. And so that was one where I'm not so sure that those jobs stayed in place. So there definitely are some uneasy times right now in people's minds. So.
Any questions? All right, thank you. Moving on to public health. Julie?
Julie McCullum, Public Health. I do have my written report here, just a couple of things. A number of public health staff and Medical Reserve Corps, along with HHS staff, did attend Crisis Intervention Partners training early in the month of April. This was provided for for us by the National Alliance on Mental Illness in Wisconsin, and they provided this training for free at LCO University, and we hosted it. So a number of our staff attended sessions on everything from mental illness, auditory hallucinations, simulation, suicide prevention, and trauma-informed care. Also, a lived experience panel was present, and there was a session on verbal de-escalation skills. Our annual report has been submitted to DHS, and you have it in your packet. Just to highlight a few things, this is a requirement, and we do submit this by May 1st of every year. And this is a recap of all of our activities within the Public Health Department in 2024. It includes communicable disease, our work on our community health improvement plan. It also includes programmatic updates, so birth to 3, WIC, immunizations. It's a high-level overview. It's there for your information. It's also posted on our website, so you can find it there. If you have any questions, please let me know. That actually was a new section with our peer recovery in 2024, as well as our MRC numbers as well were added. I did want to highlight our vaping survey. Joyce Knowlton, one of our public health staff, is here to present those results. So, first, before she gets up, do you have any questions for me? Thank you for your time.
Good evening. I'm Joyce Knowlton from Public Health. So in Public Health, we did an initiative to educate middle and high school students in Sawyer County about vaping. And before we did that education, we conducted a survey of students. We had between 350 and 400 students respond. And then we created this flyer and pushed it out through the schools. We asked them to share it with parents. We've also pushed it out through some of our partners like the Chamber of Commerce and Tamarack Hospital. But a few things I'd like you to look at is of the kids who are currently vaping or have tried vaping, you can see that most of them, a good percentage of them, started when they were 11 to 13 years old. What I find concerning is 20% of them started between the ages of 5 and 10. And that's a concern. So this fall, as part of Red Ribbon Week, we're actually going to be handing out coloring books to the younger kids, younger than middle school. That is an educational book about vaping and nicotine. When you look at the reason for starting to vape, a lot of them, 30% say peer pressure. What's interesting is some of the notes that they had, they didn't mark peer pressure, but they said they started because their friends were using, their brother was using, their sister was using it, their cousins, their mom and dad. So I'm not sure that they really have a full picture of what peer pressure is. So I think that number is actually quite a bit higher. When you asked how many times a day did they vape, you can see that 36% said 1 to 3 times a day, but 27% said more than 20 times a day they are vaping. And when we asked how vaping had affected their life, 30% said they don't breathe as well as they used to, and these are teenagers. They were tired more often and that they spend most of their money on vapes. The real concern for us is when we asked, what is in your vape? And this is where the education part comes in. So they said 55% of them said nicotine. We know that 99% of the vapes have nicotine in them. So a lot of them thought that they were using vapes that don't have nicotine in it. 20% though, had THC in their vapes, and 2% had meth. So again, these are middle and high school students. When we did the education, when we met with the students and the feedback we got after the education, probably the most surprising thing to them was number one, that the vapes have, most vapes have at least double, if not triple and more amounts of nicotine in one vape than a pack of cigarettes. The other thing that they found surprising was that there is absolutely no water vapor in a vape. So we had to remind them that these were called e-cigarettes for a reason, because they do have nicotine in them. And they changed that terminology to vape to make it sound nicer. And that's actually an aerosol that is created from the chemicals in that vape that are being heated up and then creating other chemicals like formaldehyde that they're then sucking into their lungs. So they did not know any of that. And they really thought that they did know. When we were giving the education, they all thought that they knew, but they didn't. But then when we asked what the punishment should be, this was for all students. So this was not just kids who were vaping. This was all students. And you can see they're pretty much split evenly between school suspension, taking a class, school detention, and then community service. And finally, when those kids who are currently vaping, when we said, do you want to quit? You can see a large percentage of them want to. And again, that was part of the education about how difficult it can be to quit vaping because this is an addiction. It is a drug that is affecting their brain. A big part of this education was the difference between what a vape and those chemicals do to their brain at their age compared to someone like me at my age. And that's why we are so concerned for them doing vapes. Probably the most frustrating thing for us as educators is that we don't feel that the adults understand, that the adults have this education, and it's really difficult to get that information to them. I mean, we've been putting it out on Facebook, we're pushing this. There was an article in the paper. But a lot of parents, when asked, say, well, it's not weed, it's not drugs, it's just a vape. And so I don't think they really understand the brain damage that is happening to these kids when they're putting these chemicals in their body. Also, part of the education was giving them options to quit. There are a lot of programs out there for teenagers. There are texting programs, online, phone calls, all different kinds of education. So the second page is just a reminder for them about some of the education that we gave them, about signs that they are addicted, that they're having those cravings, they're feeling anxious, it's hard for them to focus, or, they're sitting in class and thinking, I can't wait until I can get outside and go hit my vape. And that how it harms their health. And then just some facts and myths. We will be handing these out during the Muskie Fest parade. We'll be giving little bags of information. We have some swag to give them. Our motto was, don't be a cash cow. And that's because we explained to them that these companies know that if they can get them addicted young, it's going to make them rich because it's difficult to quit. So we have some swag for them. We also, as part of this education, because it's moving into talking about addiction and how that affects their brain, we also brought in Kim Dale to remind them about the fentanyl information that she had given them last year and to just reinforce that and keep them thinking about it. So, any questions? No?
I recently read an article about popcorn lung.
Yep.
That was quite interesting, and that was from the flavoring.
Yeah. Yeah, and that was part of the education also, is that, if you think about it, when you go to the doctor as an adult, they don't ask you, do you want that pill in strawberry or grape? Right? They are making those flavors because they're going for the kids. And that's why they're doing it. But those flavors, even though they have been tested and to go into your body as food, your liver filters that stuff out. Your lungs aren't the same kind of a filter. So you're actually sucking that stuff into your lungs, and it's not meant to be there. And that's what causes the popcorn lung. Yeah. Yep. So the good news is, I would say less than 20% of the kids said that they were vaping or that they had tried vaping. That pretty much falls with the national average. national average is 20%. We were at about 18. So I'm sure some people weren't completely honest, but you know, still, it's not 50%. So. All right, thanks.
Thank you, Joyce. Okay, the next is our budget. Do you want to address that, Mike? The budget performance?
Normal for this time of year.
Nothing's jumping out at you? We haven't spent all of our money in any category already?
I haven't looked line by line, but overall.
And purchase services recap? Nothing seems to jump out except for secure detention. Transportation again. Marshall, has that been worked on, the transportation with the police department? And
I don't think we've placed anybody on hold in the city yet this year. I know counties use that Assurance Transportation Company out of Spooner that just started a few times this year, but we haven't.
okay,
I'm not sure about LCOPD.
any questions about the purchase services recap? So do we have any board appointed committee updates? Correspondence, reports, or conferences and meetings? Future agenda items? Do we want to look at housing? Would this be the appropriate committee to look at housing?
It kind of ties in with the strategic plan and the forward analytics data and the whole discussion of housing that they're talking about sometimes in admin. So it should probably be in all the committees going forward.
Yeah, 2 weeks ago, I attended a conference, a finance conference, and the whole theme was TIDS and affordable housing and economic development, which was fun because usually it's accounting stuff, but this, well, it was. You know, lots of ideas. We're not unique in our problems. I presented at economic development and at finance to a study from Dane County that showed the prices of homes from 2020 to 2024 are up 84%, price of new construction. And the salaries for the household incomes only gone up 17% over that same time period. And the interest rates went from 2.9 to 7.3. So the payments, the mortgage after a 10% down payment, I crunched some numbers. It went from $850 to about $2,600. So it's tripled in 4 years. And I did a further calculation of the gross income for the family, 28% of that, which is kind of the standard for what you should spend on housing. And in 2020, there was a $500 surplus after the payment. And in 2024, it's a deficit of almost $1,975.
Wow.
That's a Dane County study. I don't think the numbers are going to be different for Sawyer, but the situation is going to be very similar. So we're getting it on the radar. The answers are harder to find than the problem.
Thank you for that report. I'm glad I bought my house 50 years ago. Great. I guess that's it for tonight. We're adjourned. Thank you, everyone.